My Food Choice is a new way of delivering food to patients in hospitals. It involves three main changes. One is reducing the time between taking the order and delivering the meal. The second is turning the food service staff from a process-driven workforce into small teams who look after the same patients. The third element, being technology, is where CBORD come into play because we wanted to take the orders closer to the meal time. Therefore, it relied on a CBORD module to become mobile to take the patient's meal order. Also, we wanted to prove that the patients were eating more food, so we went to CBORD, who helped us, and they developed the meal intake module. Therefore, that provides all the data about the patient's nutritional journey. Data provides the evidence that we're actually getting the outcomes that we're after. So we now can record what patients are ordering, we can record what they're consuming, and therefore we can identify patients who are at risk either by not ordering enough food or by not consuming the food that they're given.
So this is the nutrition dashboard that the information's fed in from the tray monitor, which the food service staff are collecting for us. So in dietetics, we're using this to surveil the intake and the ordering patterns of all the patients in the hospital. So the data is being categorised according to risk. So patients who are not going to be eating enough have been categorised in this far right column, which is the risk category column. So they're the patients we know are not receiving enough food to meet their requirements.
With the pilot, the small teams helped with the scalability because we knew how much a team of staff could deliver in the way of meals to patients, and therefore scalability was quite easy. Every 75 patients meant another team. Therefore, in a large hospital there could be 10 teams, small hospital there would be, say, one team. Business intelligence is the other side of that data. We now know what patients are ordering, how much of what they order they actually eat. Therefore, we're aware what are popular food items, what aren't popular food items. We can then go to the manufacturers and share that information with them. Therefore, we can now get into research and development with real information.
Well, I think data and reports in My Food Choice are absolutely essential. The transparency that's created in the way that the system has been designed, those data and the reports that sit behind that is the daily manifestation of how well we're doing that, and it's absolutely critical for the clinicians with the dashboards. All that information, the whole My Food system is about getting that information and data so that we can get a better patient outcome. The data is really reliable. The absolute size of the data sets means that small mistakes are lost in the overall picture, and the reliability is without a doubt an order of magnitude higher than anything else that's out there.
My Food Choice has 150 odd hospitals where it has to be introduced. That's a big program of work that's been undertaken. However, as we convert hospitals to My Food Choice, we want to leave the culture there where the staff can continue to innovate.
I believe that it has resulted in cost savings. Certainly we're doing new things with the same or less staff, and the food costs have not gone up, even though the food quality, I think, is significantly improved.